Why you always have mucus in your throat. Doctor explains the real cause. It's a sensation that far too many people intimately understand, that persistent, uncomfortable thickness in your throat, a feeling like something is perpetually lodged there, refusing to budge no matter how often you try to clear it. You find yourself constantly clearing your throat, a repetitive habit that offers only fleeting relief, if any at all. This sticky, irritating sensation often makes its unwelcome return within minutes of clearing, resurfacing by lunchtime if addressed in the morning, or immediately after a conversation begins. Perhaps you've explored countless remedies in a desperate attempt to find lasting comfort, experimenting with warm beverages infused with honey, various lozenges designed to soothe, or an array of over-the-counter syrups from the pharmacy, only to discover that none of these provide anything more than temporary distraction from the underlying problem. One of the most disheartening aspects of this chronic discomfort is the near universal response received when seeking advice. "Oh, that's just mucus," or "It's completely normal for your age, don't even worry about it." This dismissive counsel leaves you feeling unheard, frustrated, and resigned to an ongoing nuisance. However, it's imperative to understand that this persistent throat mucus is not an inevitable, unchangeable consequence of aging that you must simply endure. On the contrary, it possesses identifiable causes, and once those root causes are genuinely understood, the path to a clear, comfortable throat becomes remarkably less complex and significantly more attainable than most people, including many healthcare professionals, might lead you to believe. As Dr. Weston, with 15 years of dedicated clinical practice, I've had the privilege of working with hundreds of patients who, like you, have silently battled chronic throat clearing and an unyielding sensation of persistent mucus for months, and often even years, without ever truly comprehending the why behind their discomfort. Today, our goal is to illuminate that why for you, offering insights that delve far deeper than conventional explanations, uncovering 4 specific and frequently overlooked causes, and providing a practical, step-by-step framework you can implement immediately to naturally address this bothersome issue. I often find it profoundly helpful to hear from those experiencing this firsthand. Sharing your journey not only validates your own struggles, but also empowers others. So, if you've been grappling with persistent mucus or the constant urge to clear your throat, even if only roughly, for how long has it been a part of your daily life? And if you, like so many others, have ever been told to simply accept it as a byproduct of age, remember that your experience is far from unique, and your feelings of dismissal are widely shared, highlighting the critical need for this deeper discussion. To genuinely understand and resolve persistent throat mucus, it's crucial to first fundamentally shift our perspective on mucus itself. Mucus, at its core, is not an adversary. It is, in fact, one of your body's most exquisitely designed and utterly indispensable defense mechanisms. Every single day, your body embarks on the extraordinary task of producing a substantial and continuous supply of mucus, and it does so for a multitude of compelling physiological reasons. This remarkable substance functions as a highly effective trap, ensnaring microscopic invaders such as dust particles, airborne allergens, insidious bacteria, and potentially harmful viruses, preventing their deeper penetration into the delicate labyrinth of your airways and lungs. Beyond its role as a protective barrier, mucus diligently maintains the essential moisture of the delicate lining of your respiratory passages, safeguarding them from dryness and irritation. It is, quite literally, the vanguard of your immune system, operating ceaselessly and silently, 24 hours a day, without conscious effort on your part, tirelessly defending your internal environment. Therefore, the problem is never the mere presence of mucus itself. The issue arises when this normally fluid, easily manageable, and highly protective layer undergoes a transformative change, becoming unnaturally thick, excessively sticky, and exceedingly difficult for your body to move and clear efficiently. Instead of gracefully flowing through your intricate system and being naturally eliminated without notice, this altered mucus stagnates, accumulates, and becomes the root cause of that persistent, uncomfortable sensation in your throat, compelling you to reach for water or engage in repeated throat clearing dozens of times throughout your waking hours. This phenomenon becomes particularly pronounced as we age, a crucial detail that most individuals over 60 need to fully grasp. As the body matures, several physiological changes occur. The intricate muscles responsible for the act of swallowing gradually lose some of their youthful efficiency. The lymphatic system, a vital network tasked with draining excess fluid and preventing tissue congestion, begins to operate with a somewhat reduced capacity compared to earlier decades. And the countless microscopic hair-like structures known as cilia, which meticulously line your airways and are designed to sweep mucus upward and outward, perform their essential task at a slower pace. Consequently, any irritant that manages to enter the respiratory system tends to linger considerably longer than it would in a younger individual, rather than being swiftly and silently cleared. This cumulative effect means that environmental or internal factors, which might have elicited only a brief and barely perceptible mucus response at the age of 40, can trigger a genuinely persistent and significantly bothersome reaction at 65 or 70. Comprehending this evolving physiological context is absolutely foundational, as it provides the essential explanation for why the specific causes we are about to explore have such a pronounced and impactful effect, specifically in older adults. Consider the remarkable case of Evelyn, a wonderfully tenacious 68-year-old woman who sought my help after enduring 8 agonizing months with what she vividly described as a throat that never felt clear. Evelyn, in her earnest quest for relief, had diligently exhausted every remedy imaginable. She began each morning with a comforting honey and lemon drink, meticulously performed steam inhalations before retiring to bed each night, and systematically tried various over-the-counter preparations sourced from her local pharmacy. Yet, despite her unwavering efforts, nothing yielded any sustained relief. The frustration was compounded by the disheartening counsel she received from 2 different practitioners, both of whom simply suggested that her condition was just one of those things that happens as you get older, implying she should merely learn to manage it. However, when Evelyn and I engaged in a comprehensive consultation, meticulously reviewing her complete health picture, carefully examining her daily habits, her current medications, her sleep position, and the precise timing of her dietary intake, what emerged was not a singular, isolated cause, but rather a complex interplay of 3 distinct yet overlapping factors, none of which had ever been accurately identified or adequately addressed. Once we embarked upon a targeted, practical approach to tackle these 3 root causes, precisely the kind of actionable strategy I am eager to share with you today, Evelyn's progress was swift and profoundly encouraging. Just 3 weeks later, she messaged me with palpable joy, reporting that for the very first time in months, she had awoken 2 consecutive mornings without that persistent, uncomfortable sensation in her throat. Evelyn's transformation didn't necessitate powerful prescription treatments. What she truly needed was accurate information and the precise, practical steps tailored to her unique physiological situation. That profound understanding and actionable guidance form the very essence of what we are discussing today. Now prepare yourself, because the first and arguably most pivotal cause I am about to illuminate is one that consistently takes patients by surprise when they encounter it for the first time. It is, in fact, responsible for a highly significant proportion of persistent throat mucus cases, particularly among older adults. So I urge you to remain fully engaged, as this particular insight often proves to be the turning point that reshapes the entire experience for many individuals. This primary and most consistently overlooked culprit behind persistent throat mucus is a condition known as silent reflux, or more medically termed laryngopharyngeal reflux, LPR. Most people possess some familiarity with the concept of classic acid reflux, often experienced as that burning sensation in the chest, commonly referred to as heartburn, which might surface after a particularly heavy meal or a strong cup of coffee. This is the archetypal manifestation, and it's an experience shared by many. However, silent reflux distinguishes itself in a critically important and often deceptive manner. In cases of silent reflux, stomach acid embarks on an upward journey, not merely ascending into the lower esophagus, but continuing its ascent much further, all the way into the delicate tissues of the throat, the sensitive voice box, larynx, and sometimes even higher, impacting the nasal passages. The throat and vocal cords are inherently far more sensitive to the corrosive effects of acid than the robust lining of the esophagus. Consequently, even minuscule, almost imperceptible amounts of stomach acid reaching these highly vulnerable areas can trigger significant irritation and inflammation, often without any other overt digestive symptoms. This inherent subtlety is precisely what makes silent reflux so consistently misdiagnosed or entirely missed. Individuals experiencing silent reflux typically do not report the classic symptoms of heartburn, that telltale burning sensation in the chest, or any other obvious forms of digestive discomfort. Instead, their primary complaints revolve around a persistent, almost compulsive need to clear the throat, which is often most pronounced first thing in the morning. They might also notice a slight roughness or an unexplained change in their voice quality, occasionally describing a mild sensation of something being caught or stuck in the throat, and, of course, the unyielding, bothersome mucus that seems to return no matter what actions they take. The physiological response is entirely logical. The throat, sensing the microscopic yet constant irritation from acid contact, initiates an increased production of mucus as a protective mechanism. Your body is intelligently attempting to coat and shield the irritated tissue from further damage. This is a wholly appropriate biological defense. However, when the underlying acid exposure recurs night after night, the body's protective mucus production is ceaselessly triggered, leading to a relentless cycle. In such scenarios, no amount of throat clearing, no soothing honey drinks, or any other symptomatic relief measures can effectively address the true root cause, which is the stomach acid repeatedly reaching your throat, predominantly while you are asleep. Emerging research increasingly suggests that silent reflux is a far more prevalent cause of chronic throat symptoms, including persistent mucus, than either the general public or even many seasoned healthcare providers currently recognize. If you observe that your throat consistently feels worse upon waking in the morning compared to later in the day, if you notice an intensified need for throat clearing when you bend forward or lie down, or if your voice frequently sounds rough or distinctly different, particularly in the early morning hours, these patterns are significant indicators that warrant your genuine and immediate attention. The practical first-line approach to managing silent reflux involves implementing two straightforward yet profoundly effective lifestyle adjustments. Firstly, make a conscious effort to refrain from eating any food within 3 hours of your bedtime. When your stomach is actively engaged in the process of digesting a meal and you assume a horizontal position, the physical posture alone significantly facilitates the upward travel of stomach contents. Allowing a minimum of 3 hours of upright digestion time before lying down can make a truly meaningful difference in preventing reflux episodes. Secondly, subtly elevate the head of your bed. This doesn't mean simply piling on extra pillows, which only serves to unnaturally bend your neck and offer minimal benefit. Instead, it involves physically raising the entire head end of your bed frame by several centimeters. This can be achieved quite simply by placing small, sturdy wooden wedges or specialized risers beneath the legs of the headboard. This gentle, consistent incline leverages the power of gravity to keep stomach contents where they rightfully belong throughout the night. preventing them from irritating your throat. Here's an important pro tip number 1. If you are regularly taking any anti-inflammatory medication, such as NSAIDs for chronic joint pain, arthritis, or other persistent discomforts, it is absolutely crucial to discuss this specifically with your doctor in direct relation to your persistent throat symptoms. Certain commonly prescribed anti-inflammatory medications have a known side effect of relaxing the muscular valve, the lower esophageal sphincter, that acts as a barrier between the stomach and the esophagus. This relaxation makes it considerably easier for stomach contents, including acid, to travel upward. Furthermore, some of these medications can also diminish the stomach's natural protective lining, making it more vulnerable to acid. Both of these effects can contribute substantially to the development or worsening of silent reflux in individuals who are regularly using these medications, often without ever realizing the direct connection to their troublesome throat symptoms. Moving beyond the often silent aggressor of reflux, the second significant cause of persistent throat mucus is a condition commonly referred to as post-nasal drip stemming from chronic sinus congestion. This particular cause is frequently overlooked, with many individuals living with its effects without ever accurately identifying it, primarily because it doesn't always manifest with the dramatic, unmistakable symptoms people typically associate with severe sinus problems. Chronic sinus congestion doesn't exclusively translate into intense pressure headaches, a feeling of severe facial fullness, or completely blocked breathing passages that demand immediate attention. Rather, in a considerable number of older adults, chronic, low-level sinus inflammation quietly and persistently produces a steady, often subtle, draining of excess mucus down the back of the throat. This phenomenon is particularly exacerbated when lying down at night and during the vulnerable early morning hours immediately after rising. Imagine this scenario. You retire to bed, and as you sleep, your sinuses, which are mildly inflamed and therefore producing a slight excess of mucus, slowly and imperceptibly drain their contents downward, guided by gravity, into the sensitive back of your throat. Consequently, you awaken with that characteristic thick, uncomfortable sensation and an immediate, almost instinctive urge to clear your throat, often before you've even had your first sip of morning tea or coffee. Many individuals experiencing this subtle but persistent irritation frequently resort to purchasing over-the-counter antihistamine tablets from the pharmacy for months on end, under the assumption that they are grappling with ongoing seasonal allergies. However, in a substantial number of these cases, these medications provide only temporary symptomatic relief by artificially drying out the mucus. Crucially, they fail to address the underlying inflammation that is driving the excess mucus production. Furthermore, dried, thickened mucus is often far more difficult to move and paradoxically can be even more uncomfortable than the original, more fluid problem. The most genuinely effective and elegant approach to mitigate this specific cause is the consistent practice of regular nasal rinsing using a gentle, warm, saline solution. This involves preparing a simple mixture of warm, previously boiled water combined with a small, precise amount of plain, non-iodized salt, which is then used to gently flush each nostril once or twice daily. This therapeutic practice serves multiple beneficial functions. It meticulously washes away inflammatory irritants, airborne allergens, and accumulated pathogens from the nasal passages. It actively reduces the underlying congestion that fuels the post-nasal drip. And crucially, it helps to maintain the mucus at a thin enough consistency to be naturally and efficiently cleared by the body's own mechanisms. While this solution sounds remarkably simple in its execution, its consistent application yields real and often surprising improvements for most patients who commit to it regularly. It's truly fascinating how such a straightforward habit can make such a profound difference. Here's a valuable pro tip number 2 for optimal nasal rinsing. Always, without exception, use water that has been boiled and subsequently cooled to a comfortable, lukewarm temperature rather than directly using tap water. Tap water in numerous geographical regions contains trace amounts of microorganisms that, while entirely harmless if swallowed, should absolutely not be introduced directly into the delicate and often compromised nasal passages, as this can lead to serious infections. Boiling the water thoroughly and allowing it to cool effectively eliminates this potential concern. Additionally, consider adding a very small pinch of bicarbonate of soda, commonly known as baking soda, alongside the salt to your rinsing solution. Bicarbonate possesses a unique ability to help neutralize any acidity present in the nasal passages and supports the thinning of mucus even more effectively than salt alone, enhancing the overall therapeutic benefit of the rinse. The third significant cause that contributes to persistent throat mucus is one that frequently elicits genuine surprise from almost everyone when I first introduce it. And yet, once the underlying mechanism is explained, the connection becomes entirely logical and makes complete sense. We are referring to the impact of certain medications, many of which are routinely taken by older adults, that can directly contribute to persistent throat mucus. These medications can exert their influence through various pathways. Some may inadvertently promote the very reflux we discussed earlier. Others can directly dry out the mucus, rendering it thicker and stickier and thus harder to clear, while a distinct category can trigger a reflex response that actively increases mucus production as an undesirable side effect. One specific category that warrants particular attention is a class of medications commonly prescribed for the management of high blood pressure, known as ACE inhibitors, angiotensin-converting enzyme inhibitors. A significant number of individuals who take medications belonging to this category develop a persistent, often dry, throat-clearing sensation and an increased production of mucus, which are well-documented and medically recognized side effects. The underlying mechanism involves a naturally occurring substance within the body called bradykinin. These medications inhibit the enzyme that normally breaks down bradykinin, leading to its accumulation. In some susceptible individuals, this elevated level of bradykinin triggers a direct irritation response in the throat, manifesting as chronic coughing and, frequently, increased mucus. Therefore, if you are currently taking blood pressure medication and you've observed that your persistent throat mucus began or significantly worsened around the time you initiated that particular medication, this potential connection is absolutely worth discussing in detail with your prescribing doctor. It is highly probable that there are alternative blood pressure medications available, belonging to different pharmacological categories, that can control your blood pressure just as effectively without inducing this specific and bothersome side effect. It is paramount that I emphasize this point with absolute clarity. Please, under no circumstances, should you ever independently stop taking or alter the dosage of any prescribed medication on your own initiative. Always, without exception, engage in a comprehensive conversation with your doctor first. My intention here is simply to inform you that this medically recognized connection exists, and if you suspect it may be relevant to your unique situation, it warrants a thoughtful discussion with your healthcare provider who can guide you on the safest and most effective course of action. This crucial information has the potential to unlock new possibilities for understanding what has been happening with your throat, transforming a frustrating unknown into an actionable insight. The fourth, and often synergistically powerful, cause of persistent throat mucus arises from the combined influence of environmental irritants and insufficient hydration. These two factors frequently operate in concert, and their combined detrimental effect on throat mucus is often far greater than the impact of either factor acting in isolation. Let's first consider environmental irritants. Air contaminated with tobacco smoke, whether originating from your own smoking habits or from consistent passive exposure to secondhand smoke, inflicts significant damage upon the incredibly delicate hair-like structures, cilia, that line your airways. These cilia are vital for their role in meticulously sweeping mucus upward and outward, ensuring its natural and efficient clearance. Even if you ceased smoking many years ago, the recovery and optimal functioning of these crucial structures is a gradual and sometimes incomplete process. Beyond tobacco, a range of other common environmental irritants contribute to ongoing low-level irritation, which in turn triggers a continuous protective mucus production. These can include wood smoke emanating from fireplaces or bonfires, the potent fumes from strong household cleaning products, the ubiquitous pollution generated by heavy traffic, and the excessively dry air commonly found in heated or air-conditioned indoor environments. All of these factors create a constant assault on your respiratory lining, prompting an increased and sustained mucus response. This issue is significantly compounded by dehydration. When your body is not adequately hydrated, the mucus it produces becomes noticeably thicker, stickier, and consequently much more difficult to clear. To grasp this concept, consider the tangible difference between honey poured straight from a jar on a cold day and the very same honey when it has been slightly warmed. The fundamental chemical composition of the honey remains identical, yet its consistency changes dramatically, becoming much more fluid when warm. Your body's mucus behaves in a remarkably similar fashion. Well-hydrated mucus maintains a fluid consistency, allowing it to be easily cleared naturally and often without conscious effort. Conversely, dehydrated mucus is dense, viscous, and tends to accumulate stubbornly in the throat rather than being efficiently expelled. Here lies a critically important point regarding hydration, especially pertinent for older adults. The body's innate thirst mechanism, which normally reliably prompts us to drink, becomes less sensitive and less reliable as we age. This means that you can be experiencing a meaningful level of dehydration and yet feel no particular sensation of thirst. Consequently, if you are solely relying on thirst to signal your need for fluids, you may consistently be operating in a state of mild, chronic dehydration without even realizing it, and this directly impacts your mucus consistency. A practical and generally recommended daily fluid intake target for most adults is approximately 30 milliliters of fluid per kilogram of body weight, sourced from all liquid intake including plain water, comforting herbal teas, nourishing soups, and water-rich fruits and vegetables. Here's a highly effective pro tip number 3. Make it an unshakable habit to start every single morning with 1 or 2 full glasses of plain warm water before you consume anything else. This means before your morning coffee, before breakfast, and even before you take any morning medications. Initiating your day with warm water serves multiple vital purposes. It gently activates your digestive system. It kickstarts the essential rehydration process after the overnight fasting period. And perhaps most importantly for our discussion, it immediately begins to thin and loosen any mucus that has accumulated in your throat overnight, making it significantly easier to clear. This deceptively simple habit costs absolutely nothing, and countless individuals report it as one of the most impactful and noticeable improvements they've made in alleviating morning throat clearing. Embrace this ritual, plain warm water, before anything else, every single morning. It's also important to address several widely popular remedies that, unfortunately, do not yield the desired results, or in some cases, can even be counterproductive to our specific goal. While a mixture of sugar with lemon is a beloved home remedy, it's crucial to understand that sugar, in its concentrated form, is actually a dehydrating agent. It can draw moisture away from the delicate tissues of the throat, potentially making existing mucus even thicker and stickier, rather than thinning it out as intended. Honey, on the other hand, possesses genuine soothing properties and can indeed calm irritated throat tissue, offering temporary comfort. However, while it provides symptomatic relief, it fundamentally fails to address the deeper underlying causes of the excessive mucus production. Lastly, the common assertion that dairy products actively create mucus from nothing is a pervasive myth. Dairy itself does not stimulate the de novo production of mucus. However, in certain individuals, the specific proteins found in milk and other dairy products can interact with existing mucus, creating a sensation of increased thickness, viscosity, or a feeling of being coated, particularly if there is any degree of underlying sensitivity or intolerance. If you consistently notice that consuming dairy products seems to worsen your throat symptoms or makes your mucus feel more cumbersome, it is certainly worth trying a temporary reduction or elimination from your diet to observe whether this makes a meaningful difference for you. To bring all these invaluable insights together into a cohesive, actionable framework, let me outline a clear, practical plan you can begin implementing today to reclaim comfort and clarity in your throat. Tonight, before you retire for the evening, ensure that your last meal is consumed at least 3 full hours prior to going to sleep. This simple adjustment will significantly reduce the likelihood of silent reflux. Simultaneously, physically elevate the head of your bed using a sturdy, simple wedge placed under the legs of your headboard. Remember, an extra pillow alone is insufficient. Before you finally drift off, drink a full glass of plain warm water. Tomorrow morning, upon waking, make it an absolute priority to begin your day with 1 or 2 generous glasses of warm water before ingesting anything else. This week, invest in a simple, readily available nasal rinsing device from your local pharmacy and commit to starting daily warm saline nasal rinsing, performing the rinse once in the morning and once in the evening. Schedule an appointment with your trusted doctor to engage in an open and thorough discussion about your current list of medications, specifically drawing their attention to your persistent throat symptoms. Inquire about any medications you are taking that are known to affect throat mucus production or that could potentially be contributing to acid reaching your throat overnight. And perhaps most fundamentally, make a conscious, unwavering commitment to staying consistently and adequately hydrated throughout the entire day, rather than passively waiting for the diminishing sensation of thirst to prompt you to drink. Your throat, through that persistent, uncomfortable mucus, has been attempting to communicate something vital to you for a considerable period. This ongoing mucus is not an unavoidable, unchangeable consequence of getting older. It is, in reality, a clear and intelligible signal from your body, indicating that something within your immediate environment, the timing of your diet, your sleep posture, your hydration levels, or even your prescribed medications warrants your focused and intelligent attention. Now, armed with this comprehensive information, you possess the knowledge and the power to respond to that signal intelligently and proactively, moving beyond merely managing the symptom day after day, indefinitely. In my forthcoming video, I will delve into 5 specific foods that some compelling research suggests may actively support optimal throat health and contribute to naturally reducing inflammation in the airways, specifically for adults over 60. You will undoubtedly not want to miss that crucial information, so please ensure you are subscribed to this channel and have your notification bell activated to stay informed. If this detailed video has provided you with genuinely valuable insights today, I urge you to share it with someone you care deeply about, especially if they too have been grappling with the same persistent throat clearing and have been unhelpfully told it's simply a matter of age. That act of sharing could genuinely make a profound and positive difference in their life. Please remember, this video is presented for informational and educational purposes only, always, without exception. Consult directly with your personal doctor or a qualified healthcare professional before making any changes to your health regimen, diet, or medications. If you found this video helpful and empowering, don't forget to subscribe to the channel and hit the notification bell so you never miss another essential health tip.